Morning, everyone. I'm Pam Cook from News Talk 1480 WHBC, and welcome. We are so happy to have all of you along with us today. And this is the 2021 United Way of Greater Starr County's Women United Family Friendly Workplace Awards Program, recognizing October as National Work and Family Month. We want to do that as well. It's such an important thing that we recognize this, and it becomes more and more important every single day, because a family-friendly workplace is important and necessary. And it's one that employer is making policies and having policies for employees to balance family and work more easily and to fulfill both their family and work obligations, which we all know is extremely important. And family-friendly policies can be things like flex time and parental leave and employee family health benefits and childcare and elder care, also things like tuition for employee education. And employers, we know these days especially, are realizing the need to adapt to these kinds of changes in the workforce. And so adopting flexible workplace policies will successfully attract and retain talented and committed employees. And that's what we all want for sure. So since 2017, 14 total workplaces, including the 3 today, have been honored for going beyond what is legally required to help employees balance work and life. And so right now I would like to introduce to you Amy Mast, who is the chair of Women United, and she's going to present today's awards. Amy?
Thank you. Our first honoree is Pathway Caring for Children, a private nonprofit social service agency with over 800 mental health clients, both in community and school-based programs in 14 counties. Also provides support services to families who have adopted or providing kinship care. Several of their family-friendly workplace policies are, all 50 of their full-time staff are given a minimum of 15 paid days of personal time off. It can be used for vacation, doctor appointments, or for family commitments. Time can be used in increments of a quarter a day. Second, they provide laptops and the technology to work remotely for all staff members. This has provided the flexibility to take care of their family commitments while remaining productive for Pathway. Third, family holiday parties, not only for their clients, but also for their staff's families. Congratulations to Pathway Caring for Children for its family-friendly workplace policies. And accepting the award today is Jennifer Fallon.
Thank you, Amy, and thank you, United Way. When Pathway Caring for Children was established in 1973 by Jim and Velma Bridges, it was at that time that we not only wanted to create a family-like atmosphere for our clients, but for our staff as well. The past 18 months have been anything but easy, but it did push us to look at so many other ways that we can ensure not only our client needs were being met, but our staff needs were being met as well. We provided each of our staff with a laptop and the capability to work from home if necessary when all of this started. And that way they could not only continue to care for their family, but also to still meet the needs for Pathway to remain productive. As Amy stated, we give each of our full-time staff a minimum of 15 days of paid time off per year. They can use it for vacation, doctor appointments, mental health days, anything that they choose, basically. Although the current pandemic, they threw many hurdles to not only Pathway while trying to still meet with clients, but to our entire community. It's because of our technology that staff could choose to either work out of the office or remotely via Zoom and Teams meeting, just like we are today. Our therapists, they were able to meet via telehealth with appointments for our clients. So Pathway, we're actually very proud to say that we did not suspend our services once during the last 18 months. In fact, we were the first agency of our kind in the area to set up online training for not only our staff, but for individuals wanting to become foster parents. We have seen a 30% increase in actual licensed foster families. And we currently have 40 families pending to become foster parents as well. So thank you again for this honor. It's been a pleasure, and we will continue to keep making a difference in our community. Thank you.
Our second honoree is Kent State University at Stark County's public university. They provide the same academic excellence students expect from Kent State University, offering over 20 bachelor's degree programs Stark State residents can complete entirely at the campus. They are celebrating their 75th anniversary being in Stark County. 3 of their policies as part of their Family First initiatives are: 1, tuition waiver and generous benefits available for all employees and their families. They provide full tuition for any undergraduate college education. 2, they have flexible work arrangements available for all employees, and it is designed to support work-life balance and can be used for purposes to help employees more effectively perform daily job responsibilities. And 3rd, they have paid vacation and sick time and a leave of absence available to all employees. Employees begin with 2 weeks paid vacation and 1 week sick time. They can accrue this time, and leaves of absences can be requested for several reasons. It also allows employees to donate time to coworkers in need. Congratulations to Kent State University of Stark for its family-friendly workplace policies, and accepting the award is Dr. Robert Sturr.
Good morning, and thank you so much. I'm the Assistant Dean at the Stark campus, and on behalf of Dr. Denise Sechrist, our Dean and Chief Academic Officer, and the whole campus community, we are honored to accept this award, and thank you for this honor. We are Stark County's public university, and we exist to educate and to provide the same excellent education to students that Kent State is known for in their local communities, in their hometown. At the same time, we pride ourselves on providing an excellent work environment for the staff and faculty who find a career and essentially a home at Kent State Stark. I'd include myself among those. I came to the Stark campus in the fall of 1997. My wife, Jen, was pregnant with our first child at the time, and we've since had 3 children, and they've literally grown up on the campus. And I have internalized a lot of the values of the campus and the university. And as somebody who's now moved into a position of supervising others, I've tried to remember those lessons all along. So while we try to change lives of our students across the region through affordable, quality academic programs, we know that that begins with making our the nearly 200 people that we employ as secure and safe and supported as possible. We aim to support local families and futures, and we do things like the tuition benefit waiver, the tuition waiver benefit that provides currently undergraduate education to approximately 100 employees or their families and dependents at this time. We have instituted a telecommuting policy recently, and we've had a flexible work arrangement that makes it so that employees can balance work responsibilities with family responsibilities. And it's the kind of thing that allows us to help an employee stay a little longer at home to get a kid on the bus and then come a little later, and to balance all of the many things we know our families, our parents, and those with families do in the workplace. We have a wellness program with rewards that demonstrate to those in the campus community that we care about their whole health and wellness. And it provides benefits and rewards financially up to $300 for those who participate in wellness activities, such as getting annual wellness checks and preventative care checks, personal and group exercise classes, mindfulness and resiliency sessions. And then finally, one other item I'd like to mention is our Flashes Food Pantry. We know that even in our staff and in our campus community, among students, staff, faculty, there is food insecurity, and we're deeply concerned about that. So we've maintained Flash's Food Pantry in partnership with the Akron Canton Food Bank so that those who need can take discreetly and quietly what they need, and we make sure to support and fill a need that might be hidden to most. So we want to make sure we're there. And that pantry has stayed open during the pandemic, even as our campus operations have gone remote in large part. I thank you again for this honor. We are so happy to be recognized as a family-friendly workplace because that's what we strive to do at a hometown university. We want to strengthen families and make Stark County a great place to call home. Thank you.
Our third honoree is HP Products Incorporated, is a premier manufacturer of central vacuums and tubing related products. They have established an internationally recognized operation producing high quality products while servicing the needs of a wide customer base. Celebrating over 60 years of manufacturing success, HP continues to grow. Their family-friendly workplace policies include, 1, a partner with United Way's Prosperity at Work program. Recognizing employees were facing many outside barriers, making it difficult for them to focus on work, they launched their Prosperity to Work program last October. So far, the program has assisted 31 employees with various challenges, from utility payments, housing, transportation, and counseling. Their second policy is overtime policy, which provides work-life balance to employees. HP has 3 shifts, Monday through Friday, and Saturday overtime is now voluntary, and no one is required to work more than 9 hours per shift. The company does not believe in Sunday work. Overtime schedules are posted on Wednesday for the following week, so employees can plan any life events. Third, for 10 years, they've had Doc on-site program. They have free on-site clinic for all employees and any family members on their employees' health insurance. The program services include blood work, physicals, prescriptions, and more. HP ensures their healthcare is not just available, but affordable for employees. Congratulations to HP Products Incorporated for its family-friendly workplace policies. And accepting the award are Lauren Higgins and Abby Heddleston.
We would just want to take a moment to thank United Way for allowing us to accept the Family Workplace Award. HP is a family-owned company, and we believe in a work-life balance. At HP, we do take care of each other inside of our building and also our community. This past year, well, and I think many years, HP has participated in the United Way campaign, encouraging employees to come together and make Stark County a greater community to live in. Along with some other programs that we have in place, the Doc on Site we've found to be very beneficial to our employees here. If they're not feeling well, especially during COVID, they have really been able to help us guide our employees to make sure everybody is safe, receiving the care that they need at an affordable cost. And this is available to all employees day one of working here. We've also, through the pandemic, allowed employees to work from home who were able to. And then inside of the plant, we've ensured, a 6 feet distance, the mask requirements, everything like that to encourage that everybody is safe. During the pandemic, we did not lay off any employees or anything like that. So families were pretty confident each day going home, that they were still gonna be employed here. We did establish, or we partnered with Prosperity at Work, the United Way of Prosperity at Work for the program. And again, this has been in place for a little over a year now. We've helped many employees with this. Roughly about 10% of our company has sought help through this program. And we do believe that if we didn't have a program like this in place, we may have, lost those employees to our company. We continue to work out new policies and procedures to make sure that we do support our work-life balance. Along with overtime, we listen to our employees who were really struggling to work 6 days a week, only have Sundays off, and spend time with their family and come back, Monday ready to work. At the end of the day, they were mentally exhausted. So we, some employees depend on the overtime, and some were tired, of working and needed to spend time with their families. We honored that. We put that in place, I believe, in June of this year, and it was supposed to just be a month by month, and here we are mid-October, and I don't see that changing anytime soon. So again, we just want to thank United Way for allowing us to accept this award, and we will continue to adjust our policies so that we can support a strong work-life balance in our community. Thank you.
All right, thank you, ladies. And again, we want to say thank you to Amy, and also thank you very much to all of the award winners this morning. You all should be very, very proud, and we appreciate you coming by and giving us all of that information and sharing with us everything that you do. So that was fantastic. We want to introduce now to you our keynote speaker. It is time for our keynote speaker. She is Susan Oliveira, Senior Vice President for Human Resources, Altman Health Foundation. She has held various roles with the foundation for the past 31 years, and now she's responsible for recruiting and retaining talent. And in these very challenging times, we know that has to be a pretty tough thing for her. And she holds a Bachelor's of Business Administration from Kent State University, a Master's of Business Administration from Ashland. She's a very active member of her community, serves as a member of the Plain Township Rotary. She's a past president, Canton Regional Chamber of Commerce Education Committee, and most recently, the United Way Economic Mobility Collaborative. And again, we would like to welcome Susan Oliveira.
Good morning, everybody. Thank you, Pam. So I don't forget, I'd like to thank the United Way and Amy and the Women's Leadership Group for inviting me to present today. I think that recruiting and retaining is probably a challenge for everybody on the call today. If you're part of a business, you own your own business, you know, it's different. I've, been at Altman for 31 years, as Pam said, over 15 in this role. And I don't think I've ever seen it quite like this. There's been challenging times, but this is very unique. But, we will persevere and we will get through. So I hope that for the next 15 minutes, I can share some concepts, some things that we are doing that maybe will benefit you. Some of them probably aren't new or unique. I've already heard some of them, from our award winners today. But please, if you have a question, you can put it in the chat, or I think we have a Q&A at the end. So maybe save that. But I'm happy to answer any questions that come up throughout this. To set the background, I'm sure all of you have heard of Altman, but you may not know specifically what we're made up of. Altman is kind of a unique system in that we not only have hospitals as part of our health system, but we also have an insurance company and a college. It's a small college, but it's small and mighty, and it's been around since Altman has existed. The college was created to help provide and grow nurses for the hospital, and it's since, expanded from there. But we go by Altman Health Foundation because of that. The health plan, I'll talk a little bit more about. Maybe some of your companies offer healthcare insurance as an option for your colleagues, but it's also been around for over 30 years. And our delivery system, the college, and then our community collaborations. We do have a foundation. We do contribute to the community financially, and we also do look for grants and have a foundation to contribute to major projects under our umbrella. So let me give you a little bit of detail. I'm not going to go into all of this, but just so you know, excuse me, we have over 7,000 colleagues now. If you count the hospital in Alliance, our hospital in Orville, our flagship hospital, but which is here in Canton, that has a majority. But we have all kinds of facilities around. We have urgent cares, we have physician practices. We have, our post-acute, we call it, or our nursing home out on Woodlawn Avenue. lots of different Altman facilities spread throughout the various counties, primarily in Stark County. We have lots of volunteers. We have a dynamic women's board. And even with COVID, you know, they are still extremely active and raising funds to help build and advance medicine at our facility. Like I mentioned, our hospital, you can see a little bit about our hospital. We have a compassionate care center. It's something we're very proud of. End of life care, which is so important to families. And it was a huge addition to our organization several years ago. You can see we offer over 1,000 private rooms. It's another thing that we're proud of. Years and years ago, it was, you know, semi-private, you know, had to share a room with somebody who likes to do that. Not too many people. So we made it our mission to make them all private. And our insurance company offer various products, commercial insurance, Medicare Advantage plans. We have over 120,000 lives as part of AltCare. And then the college, just some of the programs that are offered. It started out as a nursing program, quickly branched off into radiology. We now offer a BSN degree, a BSN completion. They also have an adult education arm of Altman College, which has really been beneficial to us in the last couple of years, because if there's a position that we aren't able to fill, we've been working with our college to see if they can help us grow our own or produce them. So I'll talk a little bit more about that in a second. So that kind of sets the stage for who we are. And now let me get into a little bit more around some of the challenges and the workforce specifically for us. So this slide is a little bit busy, but I guess I'll draw your attention to the turnover slide chart to the right. You can see the blue line is Altman's turnover over the last couple of years. Let me tell you, 10 years ago, it was about 6%. You know, we had very, very little turnover. It was, not really something we worried much about. But a few years ago, it started to jump up, and you can see how it's gone. And year to date through 2021, we're at 18%. And I sure hope that it levels off, but I don't know if that will happen. You know, and to put that in comparison, because these are, you know, the benchmark is healthcare, you know, the market's currently at 19.5%. So some would say, you're doing so much better than, you know, the benchmark. You know, not for us, not when it used to be in single digits, and it's not sustainable. And let me tell you why. Let me take you over to, the green box, you know, that says net hires on it. This is something that we track and we drill down on, you know, monthly. We look at how many people we're able to hire, but then how many leave. And for years, though, the net hires, as we call them, are always in the positive. Last month in September, we were in the negative. So -5, I think it was, but it's the first time I had seen that in, you know, really in my career. Fortunately, nurses graduated, we hired a bunch of them, and we're bringing them on in September and October and November between now and the end of the year. So, hopefully we'll see that net hires number go up. But, the real issue isn't so much about net hires, because we're still able to hire people, but it's, the turnover and retention that is a challenge. If you look at the box down below, which is really what is the challenge for us, at least in healthcare, is look at the RN. We've been able to hire some, and we do have more coming, but we've lost more than we've hired. So you can see the net impact to our organization. That's tough, and so we are talking to everyone that'll talk to us upon leaving and asking them why. Healthcare is just one of the places that is hard to be right now, with COVID, the stress of the pandemic, the work that is placed on, the safety equipment that they have to wear every single day. We struggle with wearing a mask in and out of certain places. The stuff they have to wear is incredible. So what have we done? Fortunately, we do have a college, and we have, great colleges around us that also produce nurses and other healthcare professionals. So we are fortunate in this area. But, you know, we've had to look at other models of care, such as LPNs. Altman moved away and went to a primary nursing model way back when, but, you know, a very common model is to have LPNs in your inpatient units, and we were able to hire those. So we're changing that mix to continue to provide the high quality care that we need to provide to our customers and our patients. But you can kind of see what the challenge is. We're having to reinvent ourselves here and to continue to provide what we need to provide. So the impact of the market, it's just a competitive time. If you you've all read through the paper. I mean, it's on all the social media about, you know, all the people that left employment in August. You know, 4.2 million people left the job market, and, you know, what was it, 3 point something came into the market in August. You know, that's a gaping hole. So you're all feeling it. So, you know, what are we doing? Well, we're all having to raise wages. We're all having to do sign-on bonuses. We're all having to do unique things with our benefits to, you know, make it the best place to work. We're all striving to do that. You know, our model, I try and keep it simple, because I always say to our team, you've got to offer good competitive wages and benefits, you know, to even go into the other two, which is having a strong recruitment program to proactively hire the top talent, and you also have to have that to retain your people. But the other key piece in there is engagement. You can have all those things, but if you don't have good leaders and you don't have engaging programs throughout your organization, the wages and the benefits sometimes isn't enough. So, you know, like I said, we've had to offer loan forgiveness, sign-on bonuses. We've even tried to get our army of 7,000 to work for us and offered referral bonuses. Some of you may have tried that, you know, and it's a significant amount. If they can find us, you know, somebody in one of these hard to recruit areas that signs on with us, you know, it's cash in their pocket. So it has worked, and it's been a good process. We've had to compete against our competitors in the area with market adjustments, even though it might not have been budgeted for this year. The end of last year, we had to do a gratitude bonus. We didn't have to, we wanted to say thank you to our colleagues. It wasn't a huge amount, but it was something to say thank you for sticking with us, for you know, working hard and going through this pandemic. You know, we've tweaked our benefits and, you know, trying to, you know, look at things that are unique. You know, I heard a couple of our award winners today talk about, you know, free tuition to you or your family. You know, we're competing against that. It's not just around here. It's Amazon that's coming in. It's going to be, it's Walmart. It's Target. You know, they're offering 100% tuition and that's, you know, attractive to people because, you know, education is expensive. So looking at programs around that, other tuition, other benefits, that what do we need to do to make it attractive to come and work here and attractive to stay here? The entry-level job market is another challenge. It never used to be. You know, I would say that we always were able to fill some of those, you know, entry-level positions. And what I mean by those is not the ones that require, you know, the four-year degree, the nursing, the pharmacy, the therapy, the social work, that kind of thing. So, you know, it wasn't quite as challenging as it is today. So we are really studying that. What do we need to do? Is it simply wages? Is it kind of a tiered approach to moving them up throughout the organization, a career ladder? So really studying all of that and trying to, you know, put forth to our board and our finance group so that we're cost conscious as well in what we're suggesting and what we recommend. So I'm not going to go through each one of these, but what I would like to do is highlight a couple of them. maybe the ones that are newer for us, because I know many of you probably have these things already. You know, in the last couple of years, we've really tried to focus on diversity, inclusion, and equity. That's important to the generation, to everybody really, but even more important to the next generation coming into the workforce. So we've always had DI&E initiatives, but we've really amped it up in the last couple of years and gotten our employees more engaged in resource groups, minority women's resource groups, a veterans group. We have also started from one of those resource groups. We started something called Cultural Conversations. So it's just inviting anybody who's open to, a 30 to 45 minute discussion where we bring panelists in and we talk about a variety of different things. It might be focused around LGBTQ, might be focused around, the different ethnic groups, different religious groups. And that's been really well received and something that has been successful and something that we will continue. We felt like, social media is so important now. We really had to amp up our branding campaign. So working with our corporate communications department to really do some branding. Maybe one of you have gotten an email from us that said, hey, come work at Altman because we want you. We need you. So come join us. I'm sure we have a job for you. We do, like I mentioned, we do offer a Grow Our Own education program. In our nursing home, we had a really hard time attracting and retaining nursing assistants. And, with Rebecca and Strengthening Stark, we had talked before about, our state tested nurse aid programs. And long story short, we worked with Stark State early on and eventually our own college. And we now hire people from the outside of the organization, and then we put them right through an STNA program. We pay for it, but they're employees. So they're getting paid, they're going through this program, and then they're committed to us for a period of time. The experience of being an employee and going through that program has been great because they're learning and then they're applying it right away. So that's been a great program. We also started a phlebotomy program and a medical assisting program. So again, our vertical integration and having a college has really benefited us when we had a hiring need. One of the other things that we started, and then I'll move past this, but is what we call difference makers. It's kind of like a recognition program, but it's an instantaneous online kind of program where peers can go on and recognize their coworkers or recognize somebody from another department. And it's called a You Rock. So if somebody does something great for you, and it doesn't always have to be in your department. That's the great thing about it. It can be somebody down in Orville that did something for us, even if it's small, and you send them a little You Rock, and then it's advertised out to the whole organization so that they can see it, and it's done in real time. So just, recognizing people for their efforts, even the small stuff goes a long way. Trying to grow our own, build our own has helped with our recruitment and our retention. Branding ourselves and, really focusing on diversity and inclusion have been some things that we have tried. One of the biggest things that I want to spend the last few minutes talking about is, over the last 20 months, you've heard about the stress and the strain put on colleagues, especially in healthcare, but I have friends that are teachers, so I know they're going through it as well. Hospitality, there's so many people affected by the pandemic and what it has done. But specifically in healthcare, we recognized this early on. And even before the pandemic, we started thinking, in human resources, you start seeing people who come to you every day. And it's colleagues that say, I don't know how I'm going to pay my bills. Can you do something for me? I I'm so stressed out at home. I have this, that, or the other thing, you know, and they either come to HR or they go to their boss, and their boss just isn't equipped necessarily to help them with these kinds of struggles. So I would say over the last, 2 years, we've added most of these things. We've added an on-site counselor. Now they work through Altman Behavioral Health, but the counselor was hired to be specific for our colleagues. And we offer free visits for that. We offer free visits to community services, which is another local program. We have a chaplain, we have a spiritual care group within our organization. They started doing rounding. That just really helped people. You know, when you see, you know, a young individual pass away, or you see, you know, just the sadness with the families and the people and what they're going through, it takes a toll on these caregivers. Sometimes they just need somebody to talk to. So the spiritual care rounding has been really helpful. We've had professionals come in and offer virtual stress relief programs. How can you self-help? We have something called Code Lavender. This is when a unit has a particularly hard day or event that happens. If there's a trauma in the emergency room, or like a month ago, there were a couple of young deaths in our ICU. That weighs heavy on the team. So the Code Lavender team is a group that comes in and they set up a room, and they're just there for the people. And it's staffed with counselors and, you know, snacks and relaxation and different things like that for them, just for them. And they keep it up for a while, and it makes a difference to show you care. And we try and incorporate some fun, take your mind off the heavy that you deal with every single day and have a little fun. 2 weeks ago, we brought in food trucks, and we did it on days and afternoons and nights. So we are so thankful for the vendors out there that were willing to come on midnights. Actually, it was, Swenson's came on midnights. Oh my gosh, I think people came in on midnights just to hit the food truck at Swenson's. So anyway, that makes a difference to people. It helps pull them away, even if it's for a few minutes. And so those kinds of things are important too. But I would say one of the greatest things that we've done in the last, year and a half to 2 years is partnering it with United Way on prosperity at work. I know HP Products also has prosperity at work. We started talking to Maria Heggie and Angela Persick, more than 2 years ago about the needs of our colleagues. And we said, we know there's a lot of community support out there, but it's just so hard to, all of our managers or us in human resources to know, how do we connect them? It takes time. And by then, maybe the urgency has passed. So, in talking to them, they said there was this model, not necessarily around here, but they, did lots of research on it and brought it back. And, we were all in, so prosperity at work is something that we rolled out to our colleagues in August of 2020, which was in the first stages of the pandemic. And it's been really well received. The goal initially was to have an on-site connector. The connector is a dedicated person to your company who helps connect your colleagues to those resources that are needed, helps to remove those barriers so that the colleagues can be successful at work. If you come to work and you're worried about how you're going to pay your bills, or your car's not working, or your kids, whatever it might be, that distracts you from work. Sometimes it causes attendance issues. And we saw some of that. And I'll share some of our successes really quickly because I'm running up on my time here. But our goals were primarily to help our colleagues, show care and concern, help remove those barriers so that they can be successful, because in the end, it helps with recruitment and retention. So you can see our rollout. Again, we started small. We wanted to make sure that we were doing it right and work out the bugs. Thanks to Robin, Brittany Palaswat, and Shauna, who is our current connector, for helping us navigate this. It's been a great success. And, you know, with 7,000 colleagues, we didn't want to, you know, kill our poor connector. And so we've rolled out in phases, and, you know, we're almost there. We're going to be rolling out to the rest of the organization by the end of this year. So some of our successes quickly, and, you know, and this is confidential. We don't know necessarily names, you know, specifics, but, you know, some of the successes that we've had early on, you know, we had a colleague that contacted Prosperity at Work who was struggling with, you know, his finances, you know, and I think Prosperity at Work helped connect him and helped him pay his rent. And, you know, in the long run, they hooked him up with the Cars to Careers program, which is, you know, helping them to, you know, fix or purchase, get a loan to get a car. And, you know, that helps with work. If you can't get to work because you don't have a car, or your husband and wife both work and one of the cars is broken, this is, you know, really important. We had another colleague who, this was really powerful, when a manager recognized a colleague who was late for work and was on the verge of discipline, suspension, and then eventually termination, and started to have a heart-to-heart and thought something wasn't quite right. Hooked up this colleague with our connector and Prosperity at Work. And what we found out is there was a domestic violence situation going on at home. And through Prosperity at Work and their connections with domestic violence, was able to help this individual and worked through their situation. And, you know, that's just so important. And that manager was so thankful, because here was a good employee who she was on the verge of parting ways with because of attendance, and didn't want to do that, knew there was just something that wasn't quite right, but she wasn't equipped to help them. So this really helped. We had another colleague who was in a severe car accident, and, you know, through the resources at United Way, got rent assistance because they couldn't work. They got behind on their bills. And, you know, this is just one of the programs that helped this colleague. You know, and most recently, there's a situation currently going on now. You know, one of our colleagues, again, a manager who recognized some problems, attendance issues, some, you know, communication to coworkers about a developmentally delayed child that this colleague has. Husband is having some trouble with the law. Good worker, but reporting off or not showing up, not calling, that kind of thing. So connecting this colleague to Prosperity at Work and our connector to offer hopefully multiple opportunities, parenting resources, childcare resources, mental health, because this colleague has anxiety themselves, so mental health counselor for them, and then legal aid to help with some of the legal issues that they're going through. So, you know, I could probably, you know, rattle off a few more. I hope you get the idea, but, you know, really focusing and calling well-being, at least for us in the last couple of years, has been a differentiator. And, you know, I do believe it's helped with recruitment and retention. It's a unique idea that maybe some of you should consider. I know Robin and the United Way are always willing to talk about it. So I've gone beyond my time, and I'm sorry about that for Pam and Amy and everybody trying to stay on track. But I'll certainly answer any questions as part of the next section. So Pam, I think I'm handing it back over to you.
Yes, Susan, thank you so much. It's okay that you went past your time, because that's a lot of great information. Honestly, a lot that everybody needs to know and think about for sure. So we definitely want to go on to our panel discussion now. And if you have any questions, feel free to type them into the Q&A box, and we'll get to them as time permits for us. And our panelists are going to be Amy Mast, who you met earlier, chair of the Women United, Rebecca Kuzma, COO of Strengthening Stark, Robin Seaman, Director of Prosperity at Work, United Way of Greater Stark County, and our keynote speaker, Susan Oliveira. So we'll start out with Amy. We'll start with Amy right now. And Amy, this year, Women United is celebrating 5 years of advocating for family-friendly workplace policies. So can you tell us how the whole initiative started, how it all got started?
Sure. As part of our advocacy platform of family-friendly workplace, we established in 2017 an annual Family Friendly Workplace Awards and event in October, recognizing National Work and Family Month. The event highlights the mutual benefit for organizations and employees of creating family-friendly policies and to provide employers a better understanding of work-life needs of their employees.
Also, talk to us a little bit about some of the key policies from some of the previous and current winners of the awards. How have they stood out to you?
Well, a couple of past, I'll just speak on a couple of the past winners. One was Mac Trailer, and that was a couple of years ago. They had a comprehensive approach to employees with identifying barriers from the initial hire and providing a number of wraparound services that connected employees and their families to a support system. Another one was Karcher Group, which was one of our smallest employers. They had less than 50 employees, but they provided both maternity and paternity paid leave. And last year, one of our, during the pandemic, Synchrony Financial, during the COVID pandemic, provided all necessary equipment for their employees to work at home. And last summer, they also provided online summer camp for children of working parents. That was all paid for, developed, and parents could access that on a daily basis. So those are just some of the ones that have stood out. They've all the companies and winners have done it, have had great policies.
And we'll bring in Rebecca now. Rebecca Kuzma, COO of Strengthening Stark. Rebecca, you know, we heard about how employers like Altman are supporting employees. And share with us a little bit how Strengthening Stark is supporting job seekers and preparing them for success.
Thanks, Pam. Good morning, everybody, and congratulations to all of our winners and all of our past winners. It's exciting to be with you this morning and to hear all the amazing things that are going on in our community. As many of you know, Strengthening Stark is really a movement. We're not an organization. Strengthening Stark is you. And you heard this morning all of the amazing things that are going on. Dr. Sturr even used the word, we want to strengthen our community. And that's really what we're all about, is bringing people together and community organizations together to make Stark a better place to live and grow your family, to move your business, and also to develop your talents and your careers. And one of the things we work on most frequently is this idea of connecting job seekers to jobs and jobs to the job seekers. And I wanted to share this with you because these are the partners that are involved in that literally on a day-to-day basis. Again, it's the work that they're doing in our community that is really helping to strengthen Stark. And you can see we have agencies who bring job seekers to the table. We have career navigators who are helping support those job seekers. And then we have a myriad of employers and job connectors, many of whom you heard from this morning, who participate with us in this work. The navigators are sort of the central place where a job seeker can find support, whether they need help with resumes, clothes to interview in, interviewing skills, and even those wraparound services that you heard from many of the folks that have talked this morning. The ideas of barriers that face these candidates are overlapping. Rarely is there one issue that is causing them problems. And so the navigators are able to find all of the various resources, much like Prosperity at Work is doing for already employed people. And so they are helping them overcome these barriers and overcome that psychological pressure that is there every day and makes it difficult to be a good employee when you get there. So we really, really thank all of these navigators and the work that they're doing. And we also want to say, They're not listed on this chart that I just shared with you, but the employers are such a critical piece of this. They come together with our navigators. They talk about the culture of their organization. They talk about some of the services that you're providing. And quite honestly, sometimes our navigators challenge those employers to think more deeply about these issues and how they can support employees. And as I said, I think flexibility is the watchword these days. It has always been important to employees, but in this COVID environment, I'd like to say post-COVID, but I think we're still working our way through it. In this COVID environment, that idea of flexibility has become more and more important. As people stayed home with their families, they realized how valuable it was to be there for their children when they got on the bus. And things like that are just becoming more and more important. So to the degree that employers can think about that and work with their employees on flexibility, I think is one of the key things. So again, thank you so much to all the work that's going on out there. And we'd love to have you join the Career Connect process. If you're interested as an employer or as a support organization, please reach out after the session. I'd be happy to talk with you.
Thank you. Thank you so much. And again, if you have a question, go ahead and put it into the Q&A box and we will get to those as time permits. And we have Robin Seaman, who is Director of Prosperity at Work, United Way of Greater Stark County. And Robin, we were able to hear from Susan about how Altman has been working with United Way of Greater Stark County. Can you tell us more about the Prosperity at Work and the impact that that is having on our local workplaces?
Sure, thank you. So Prosperity at Work is a solution-driven, collaborative effort dedicated to improving the workplace, creating stable employees, while assisting with retention and productivity and advancement for the workforce and for the business. Very much collaborative based. It's based on a resource connector being available to sit down and engage an employee. And engage an employee the way HR really doesn't have the time to do, nor it's typically a non-HR issue. So it makes better sense for someone that's trained around community resources to be able to assist that employee. We actually look at each employee's unique situation. And when we look at their unique situation, we can oftentimes uncover, as Susan had mentioned, the lady that was dealing with domestic violence, we uncover the crisis and then go a little bit deeper and find out what the root causes are. We provide that wraparound support connecting to different community resources or internal resources that we have through our direct services programs at United Way. I would say the thing that sticks out to me and that I like to stress is that through survey, every one of our employees that we work with our employers, we put out a survey. 69% of those employees report that they're dealing with, and they know it impacts their work, household and financial instability. It impacts their work to approximately about 3 hours a week during the work time. So that's a major issue and distraction, which we know, depending upon the business you're in, can lead to mistakes. It can lead to added stress to other employees that work with that team. It can also lead to accidents. Which all of those are costly factors to employers at the end of the day. The other thing we see is that when they're dealing with financial issues, oftentimes that means they're working longer, they're working past the age of 65, they're borrowing oftentimes from their 401k, and just struggling to make ends meet. And so this program being offered to the employers in the area provides an opportunity for those situations to be resolved. We always look at it as providing stability today so that tomorrow they can prosper. And so that's our focus as we work with employers.
All right, and I want to bring Susan back in too, Susan Oliveira, who was our keynote speaker. And Susan, you were going through all of the different things that you offered. I have to ask you, what's been the reaction from the employees? When they've been on the receiving end of these things, what kind of things are they saying to you guys, and what feedback are you getting?
They're thankful, we care about them more than just, the job that we need them to do, that we care about them as individuals, about their family. So it's been really well received. You know, and trust me, it hasn't been the magic cure for everything. You know, all of that I presented, you know, it's still a challenge for people. And, you know, sometimes all of that stuff isn't enough to even keep them. So, you know, the whole focus is, you know, engagement, try and be there for them where they're at. And, but the feedback's been very good so far.
So how do employers make sure that their employees are aware of all the benefits there are to them? How do they, you know, make sure that word is out there?
Yeah, so we have it in multiple places. We share it with them before they decide to hire on. You know, talent recruiters have turned into salespeople. You know, they're out there trying to, you know, sell our business because they have options. They have so many great options. So it's, you know, one of the first things they put in front of them, and they're trying to sell how great it is. And so they hear about it at the very beginning. We go over it when they're onboarded. It's on our website and, you know, accessible via our portal and everything like that. And trust me, every year they look forward to, we put together an actual online book that highlights anything that's new or changed. And, you know, they look forward to seeing that. And I think there was one other question, Pam. I'll jump right in and do that real quick. Daycare costs is a rising concern for our community, especially working mothers. Does Altman provide any support for those employees? I mean, Altman has an on-site childcare center, and it's, you know, is one of the advantages that we have. There aren't many organizations and not any hospitals around that I know of that still have an on-site childcare center. And I'm glad we kept it because we do have it's probably 120 colleagues have their children there. And, you know, it is at a lower rate. We do partner with a company that offers a curriculum. So it's not just, you know, watch your kids. They're actually learning and growing there. So, and then it's so convenient and close. So it does provide support and comfort for those colleagues that have to be at work and they have kids there. So hopefully I answered that question.
Yeah, very good. Well, it's been such a great morning with a lot of really good information, and you know, it makes you feel good about wanting to go to these places. You talk about retention and all of those kinds of things. That's what everybody's looking for today, and there's no doubt about it. And it's getting to be a bigger and bigger issue. And all of these things together can certainly play a great part in making all of that happen. I'm going to turn things back over now to Amy Mast. Amy is going to have a final word for everyone this morning.
Amy, you're on mute.
Thank you. On behalf of the greater Stark County United Way's Women United, we would like to thank all who participated and for attending today's event. And we encourage you to consider how you can apply these ideas and programs at your workplace. Thanks.
Thank you, everyone. Have a good day.
Yeah.